Human METAPNEUMOVIRUS or HMPV is a common respiratory virus. It can cause colds, coughs, and bronchitis. In severe cases, HMPV can lead to pneumonia, especially in young children, older adults, and people with weakened immune systems. Symptoms of HMPV are similar to those of other respiratory viruses, such as the flu or RSV. These symptoms can include runny nose, cough, fever, wheezing, and difficulty breathing. Most people recover from HMPV within a week or two. However, some people may develop more serious complications. Infants and young children are most likely to experience severe HMPV infections. Older adults and people with underlying health conditions are also at increased risk of complications. It's important to be aware of the signs and symptoms of HMPV. China has recently experienced a surge in human metapneumovirus or HMPV cases. This has put a strain on healthcare systems. The exact reasons for this increase are complex and not fully understood. However, several factors likely contribute to the outbreak. One factor is the easing of COVID-19 restrictions. These restrictions, while necessary to control the pandemic, also reduced the spread of other respiratory viruses. As people resumed normal activities, HMPV and other viruses had more opportunities to circulate. Another possibility is viral interference. Sometimes the dominance of one virus can suppress the circulation of others. The decline of COVID-19 may have created a void that HMPV was able to fill. Additionally, waning immunity could play a role. People build immunity to viruses through exposure. However, this immunity can decline over time. As a result, populations may become more susceptible to infections. The recent surge in China highlights the unpredictable nature of viruses. It also underscores the importance of ongoing surveillance and public health measures. Human metapneumovirus or HMPV is also common in the United States. It typically circulates during the winter and spring months. Like in China, HMPV can cause a range of respiratory illnesses, from mild colds to severe pneumonia. The virus spreads through respiratory droplets. These droplets are released when an infected person coughs or sneezes. People can become infected by inhaling these droplets or by touching contaminated surfaces and then touching their face. While most people recover from HMPV without complications, certain groups are at higher risk. These include young children, older adults, and individuals with weakened immune systems. The Centers for Disease Control and Prevention, or CDC, monitors HMPV activity in the U.S. They provide guidance on prevention and treatment. It is important to stay informed about HMPV and take steps to protect yourself and others. There are several things you can do to protect yourself and others from HMPV. These measures are similar to those used to prevent other respiratory viruses, such as the flu and COVID-19. First, practice good hand hygiene. Wash your hands frequently with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Second, cover your coughs and sneezes. Use a tissue to cover your mouth and nose when you cough or sneeze. Throw away the tissue immediately and wash your hands. If you don't have a tissue, cough or sneeze into your elbow. Third, avoid close contact with people who are sick. If you are sick, stay home from work or school to avoid spreading the virus to others. Finally, consider wearing a mask in crowded indoor settings, especially if you are at high risk for complications from respiratory infections. Most people with HMPV have mild symptoms and can recover at home with rest and fluids. However, it's important to seek medical attention if you or your child experience any of the following: difficulty breathing or shortness of breath, high fever that doesn't come down with medication, signs of dehydration such as decreased urination or dry mouth, wheezing or a whistling sound when breathing, or a bluish color around the lips or fingernails. If you are concerned about your symptoms or your child's symptoms, don't hesitate to contact your healthcare provider. They can assess your condition and determine the best course of treatment. Staying informed about HMPV and taking preventive measures can help protect you and your loved ones from this common respiratory virus. For more updates and information, make sure to subscribe to our YouTube channel. Stay safe and stay informed.